Will I have the vaccine? In today's video is one that many of you have requested over the last 24 hours. It's Dr. Mike's recent conversation with Dr. Fauci on the vaccine rollout. Before I jump into the video, just a very quick reminder as always that I'm now offering the stool test, the organic acids test, the SIBO test and consult via my website. So if you have any health or digestive problems, then consider taking these tests as they will provide a lot of very detailed information upon which you can start making informed decisions and then start getting your health back on track. And on that bombshell, to the video. So I just want to start this video by saying that I have no business talking about vaccines. I'm not qualified to talk about vaccines, but seeing as many of you asked about me reviewing this video, I thought it would be an interesting video to make. And make sure you stay around until the end of the video because I will give you my honest opinions on the vaccine and I will also discuss whether I will be getting the vaccine myself or not.
Well, Dr. Fauci, thank you so much for joining us on the YouTube channel again. It's been a year since you and I have spoken. We're doing it now in person without masks on. Right. Thanks to the vaccine.
It certainly does appear that way. Vaccine 1, COVID-19 0. We have seen in the UK in a relatively short period of time, we've gone from relatively high death rates to very low death rates, so long may this continue, and it's an absolute credit to the scientists that we have on this planet.
How amazing is that?
Indeed, it's really one of the most important contributions in biomedical research to so quickly and effectively get a vaccine that right now is performing in the real world even better than it did in the clinical trials.
Yeah, I agree with this. So the virus was first reported in Wuhan in China on the 31st of December 2019. And within approximately 4 weeks, the virus had been sequenced and the scientific community had developed a vaccine. Let me just say that again, within 4 weeks of the virus being reported, scientists had already developed a vaccine that they knew would work. It's absolutely incredible how far science has come just in the last 40 years. DNA sequencing and other technologies were developed in the 1970s, and without these, we would be in a completely different situation now with COVID, with no clear end in sight. Again, just to repeat, it's a testament to science and scientific communities around the world where we are now at.
So you feel more confident in the vaccine now than perhaps you did in December 2020?
Oh yeah, and the reason is that in December 2020, we had the results of the clinical trials, which were very impressive, 94%, 95%.
Again, that is crazy that in just a few weeks and months of detecting the virus, we had a vaccine that was in the late 90% in terms of its effectiveness.
But often is the case is that when you get into the real world of how the vaccine performs outside of the pristine conditions of the clinical trials, it doesn't usually look as good as it looks in the clinical trials.
Again, that is also very true in that there may often be discrepancies in lab testing of medications and vaccine and real-world outcomes, and some of this may be due to the pharmaceuticals overplaying the effectiveness, but equally when you roll out medications, you can never really be truly confident in how they will work. But again, for these vaccines to be working above the levels of expectations that were set is very cool.
On the contrary, we're seeing the opposite now. We're seeing that when you get data, not only from the United States, I mean, when I say data, I'm talking about hundreds of thousands of people being followed up in prospective cohort studies. The data are at least as good, if not even better.
Again, COVID 0, vaccine 1.
Not only against what we call the wild type virus, namely the one that's the standard one, but when variants appear, the vaccine seems to do quite well against them also. So it really is very good news with regard to vaccine.
That has always been the worry with COVID, in that would the developed vaccines be effective on the virus as it travels around the world and undergoes mutations? What is good at the moment, and particularly what we are seeing in the UK, is that the current vaccines are still effective on these mutations. Now, it may be that the vaccines need modifying over the next 12 to 18 months as the virus undergoes further mutations, but for now, the outlook looks very promising.
In this year, how do you feel where we are in our current battle with the pandemic?
Overall, I think it's very positive, but one of the things that we get concerned about is declaring victory prematurely. Because even though if you look at all of the parameters, particularly most recently, over the last month or two, is that the 7-day average of daily cases continues to come down and down. One of the issues with that is if we see the numbers go down and people say, well, then why should I get vaccinated? Everything seems to be going well. That's a mistake.
Again, I couldn't agree more with this. I see this a lot in the UK at the moment with only 50% of the job complete. Many people are really not listening to the guidelines anymore, and there is a lot of people who are really taking their foot off the gas when we are not in a place to do so.
If you don't really get the level down very, very low, there's always the concern, and the real concern, not just theoretical, that you could start getting more infections. At least in this country, we're in a very fortunate situation that we have enough vaccines to vaccinate everybody. When you look at other countries where they're literally and figuratively dying to get vaccinated because they don't have enough vaccines. I mean, take India, has 2 to 3% of their population is fully vaccinated, and about 11 to 12% have received at least one dose.
I am hoping that they will go much deeper into this conversation about the disparities between vaccine rollouts in the West and also vaccine rollouts in countries with very poor medical systems. We have an obligation in the West to better support these countries because we will not truly get on top of the pandemic without this level of cooperation between countries.
I mean, that is not good.
Absolutely, and I've heard you say numbers 70 to 80% might be a target that we're looking for individuals to be vaccinated in order to reach this level of herd immunity. Are you still confident in those figures?
So here, I just want to clarify the term herd immunity because there are a lot of people who get confused about what it means. So we have a few different forms of herd immunity, but it all boils down to herd immunity that stops the transmission of a virus or disease from person to person, or herd immunity that prevents serious impacts on a person's health and well-being. So very few vaccines will stop the transmission of the disease. This is incredibly difficult to design vaccines this way. Most just stop the person suffering severe health complications, which is obviously really important. I just wanted to mention this very quickly because many people online and in the media are saying that the COVID vaccine will stop the transmission from person to person, and with the limited data that we have, this is not something that anyone can say with any level of confidence.
One of the things we want to re-emphasize, because people say, well, you're changing. We're not changing any numbers. We don't know what the threshold of herd immunity is.
Yep. We
know what it is for measles. We're estimating that it's somewhere between 70 and 85% for SARS-CoV-2, but we don't know for sure.
I think the 75 to 80% number that Dr Fauci is referring to here is the number of people vaccinated so that we can get back to some level of normality. It is not necessarily by vaccinating 75 to 80% of people it will stop the transmission of the virus, because as we know, there is very little evidence that has been produced in the UK to say this is actually the case.
When you don't know for sure, the thing to do is just forge ahead.
Over-deliver.
Yeah, just get as many people vaccinated as you possibly can. And when you get that level of protection that turns out to be the threshold of herd immunity, you'll know it.
I agree with everything that he said there. There is no point in speculating what the magic number is for herd immunity. You vaccinate as many people as you can and then you let the data inform you.
Of course, you'll see the infections almost disappear when you get it to that level.
I'm not sure anyone can say that with confidence. As it stands today, there is very little evidence that the vaccine will stop transmission from person to person, but this may obviously change over time. Even if 100% of people have the vaccine, the virus is still there. It's just not as serious when someone catches COVID.
Where does natural immunity play into this? Because the last time you and I spoke, one of the major questions we were answering, granted it was April 2020 at the time, was that we believed, and I think we still believe, that reinfection is very rare.
Yes, it is.
Where do those individuals fall on that 70-80% spectrum? Do we factor them into that number?
Well, we're talking about vaccines now when we talk about the president's goal. If you're talking about this somewhat elusive term of threshold of herd immunity, you put them all in the same bucket. Because if you have someone who's been infected, recovered, has a good immune response, that person can be protected for a considerable period of time.
It will be interesting to understand when we have the evidence how long immunity actually lasts for. Will it be a couple of years or will it be 10 years? And this will ultimately determine the vaccine schedules around the world. Although hopefully the strength of the virus will dissipate over time until it becomes a common seasonal flu type event.
We still don't know. I mean, people ask, how could you not know? The reason we don't know is because we've only been doing this for about a year or more.
Yeah.
You know, I mean, the whole thing has been about 16 months, but the vaccine plus infected people, we don't know. We hope it's considerably longer than 6 months a year. The companies have said, well, you're probably going to need it. We don't know it's going to be a year.
Exactly. I've seen no evidence to show that we need a booster.
Exactly.
Yet the Pfizer CEO, do you think that's a business decision more than
Well,
Of course it will be. If we are led to believe that you need booster jabs every few years, then it's a nice little revenue stream for these companies.
I think what they want to do is they want to be prepared, and that's the reason why. And that's the reason why we, the federal government, in collaboration with industry, are actually doing trials to give boosts to people from the original clinical trials to determine how high up you get their response, how long it lasts. So we're anticipating the possibility, maybe the likelihood, but certainly the possibility of needing to boost people at some time or other.
I think it is very important that we get the answers to that question as quickly as possible, and that evidence absolutely needs to be released by the pharmaceuticals into the public domain.
Both for the durability of the response, but also to get maybe a variant-specific boost. However, the good news about that, as I mentioned a little bit ago, is that many of the variants, particularly the dominant one for us right now is B117. The vaccine works extremely well. A number of studies now have looked at what it does to some of the other variants, and although it diminishes your effectiveness a bit, it's still well within the realm of some reasonably good protection.
That's great because it enables more and more people to get back to a normal existence if that's the case.
Because ultimately, our goal, at least the way I view it, with the COVID-19 vaccination is really to target severe illness, hospitalizations, and deaths. Because if we can control those numbers, turning it into a perhaps less lethal virus, more like the flu, it becomes more manageable. Is that sort of
No,
our
absolutely.
strategy?
And that's one of the things that we're working with now, trying to get a good handle on what the right approach would be with the variants, because we are going to continue to see variants until the rest of the world is essentially well controlled, which it won't be for a couple of years, even if we push to get people back. We want to get the rest of the world vaccinated as quickly as possible.
That's the key here, I think. There is no point just having the wealthy countries vaccinated, because if we don't successfully vaccinate the entire world, then we will just see more and more mutations, and the vaccines may hypothetically become less and less effective.
I believe we have, a moral responsibility to do that, not only because we're a country that has resources, but other of the rich countries should do that. But it's also in our own self-interest, because when you have a lot of dynamics of viral replication in whatever country in the world, it will generate variants, and when it does, sooner or later, because of the interconnectivity in the world, we're going to see variants here.
We have now developed single-dose COVID vaccines that have been approved in many countries around the world. I think personally that these absolutely need to be given to countries that have COVID cases out of control. Ethically or morally or whatever you want to call it, the West has a duty here.
But one of the things that we really want to nail down, but it looks, as I mentioned, it looks pretty good, that if you get a high level of immunity against the original virus, it does spill over to protection against several of the variants.
For individuals who are vaccine hesitant, they've seen CDC guidelines change, a lot of times rightfully so, because the evidence evolved and we needed to make different recommendations. What do you say to those individuals who are vaccine hesitant right now?
I think this is where the conversation gets really interesting, because it's a super hot topic right now.
Well, first of all, you don't want to be pointing a finger at them or making them feel guilty. You want to try and explain to them why it's important for them to get vaccinated.
100% agree with that, and you absolutely shouldn't give people half-truths or play down unknowns or potential risk factors.
By giving them two things, giving them all the facts that they need to answer any questions that they have. Was it too quick? No, we have an answer to that. It's the culmination of decades of research that got us there. It wasn't the 11 months from January to December. Then they ask, well, did you test it enough? I want to wait and see. Well, hundreds of millions of people have gotten the vaccine now. So we're past the time of let's wait and see.
I largely agree with everything that Dr. Fauci said there, but with problems, if there are ever any, then it can often take a while for these to surface. Look at how many medications over the last 30 years have been prescribed only to be pulled from the market because of the harms that they have caused. If you are going to ask people to vaccinate, then it's like Dr. Fauci says, then you have to give people the honest facts that are available at that time, and then allow people to make an individual choice based on the known pros, cons, and also risk factors.
The other thing is to make it extraordinarily easy for somebody to get vaccinated, because there sometimes is a combination of hesitancy and what they consider inconvenience. Remember back early on, people were trying to negotiate computers and getting an appointment, and this 1A group, 1B, 1C, that's gone now. Right now, the way it is, it's extraordinarily easy to get a vaccine. You got 40,000 pharmacies that can do it. You have pharmacies where you don't even need to call up or make an appointment. You just walk in and say, I want to get vaccinated.
Agreed, and this is a testament to many scientists, healthcare workers, and volunteers around the world.
You have community vaccine centers. You have mobile units. It's very easy to get vaccinated right now.
Yeah, I work a lot with Senate Majority Leader Chuck Schumer in pushing out some of the information about the vaccine to help individuals who are perhaps vaccine hesitant or just want more information on the subject. They're also asking a repeated question about vaccinations and their children. You know, Pfizer has the approval, at least the EUA, for 12 and up now. What do you say to someone who's vaccine hesitant for their children when they're saying, well, you know, children seem to experience a milder case perhaps of COVID-19. They're not perhaps spreading it as often. Should children be vaccinated?
I think this is one of the most contentious areas of vaccinations, and it always creates so much debate with many parents around the world. So let's see what Dr. Fauci says here.
Yeah, I mean, there's no doubt. It's the chain of transmission, and even though children statistically don't get a serious disease, they can. They can. And if you look at the hospitalizations, it's absolutely correct. Very low for the children. It gets more and more and more as you go up for the elderly. But if you look now, today, where the overwhelming majority of the elderly are protected, we have, about 80% of the elderly have at least one dose. I mean, that's pretty good. And the hospitalizations and deaths among the elderly dramatically diminished. Then you're starting to see, well, young people do get infected and some of them do get sick.
Again, I agree with what is being said here. When people say, oh, well, the death rates are low for children, they are absolutely correct. On screen now, you can see some age-specific data for 7 countries showing estimated all-cause deaths compared to COVID-19 deaths. These deaths are approximately from the 1st of March 2020 to the 1st of February 2021. In these 7 countries, they analysed 231 deaths that were a direct result of COVID. So that is 231 families who had to bury their children unnecessarily. Almost certainly, the vaccine could have prevented most of these deaths.
So it's, again, the health of the person. Even if you get mild disease, kids, young people get long COVID, there's no doubt. That persistence of that really sometimes almost incapacitating symptoms of fatigue and muscle ache and temperature dysregulation, things like that.
So I couldn't find any real significant evidence on long-term COVID and also vaccines. It is still an unknown, so I'm not sure what Dr. Fauci is insinuating here. But again, I'm pretty sure that in his job, he gets to see data that probably a lowly YouTuber like me certainly won't see until weeks or months down the line.
And then there's the chain of transmission. That, you'll see papers that say kids don't transmit it much. Kids can transmit it. Anybody that says that they don't, they're not looking at reality. They may, at certain levels, not transmit it as efficiently as the crowding that you get as you get older and the kind of things that people do indoors. But it is part of the chain of transmission.
Again, fully agree. To say or suggest that children do not contribute towards transmission is pretty ridiculous.
If you are vaccinated, whether you're 50 years old, 20 years old, 65 years old, what can you feel comfortable doing once you are vaccinated?
Again, there's a variability. I think people who are significantly immunosuppressed transplant patients, people who are on immunosuppressive therapy, they may want to be a little bit more careful with regard to masks, but the general average person who is vaccinated can, for their own safety, do almost anything.
That's a pretty reassuring and confident answer. In the UK, the guidance is a little bit more cautious, but we can certainly see at this stage the impacts that the vaccines are having.
I mean, indoors or outdoors. The question is when you're in a mixed environment where you're in an establishment, there are people who are vaccinated, people who are not, there are people who might be infected, that might be infecting others. There's the question of what is the establishment going to do? Are they going to say, if you want to come into my, whatever the establishment is, it could be a college, it could be a workplace. That person has almost the right, if you want to say, if you want to do that, you got to wear a mask.
I agree with that absolutely. These decisions are being made to save lives. Now, it may be in 18 months' time that it becomes abundantly clear that wearing face masks or this or that had little impact. But for now, while the evidence supports these practices, then people have to respect their fellow humans.
Which then will have the vaccinated person will say, well, wait a minute. I'm vaccinated, why do I got to wear a mask?
Yeah.
And that's where the confusion comes in, which they're trying to sort out.
Once everyone is vaccinated, or the 70-80% numbers are hit for herd immunity, what happens? Does COVID-19 go away?
Well, it certainly will go to a level that would no longer be a public health hazard, as it were, in this country. But again, it's a global pandemic, and we do require a global response.
Exactly. If 70% of people take the vaccine, there are still 30% who haven't taken the vaccine. Now, this may be down to choice, or even people who can't take the vaccine due to health problems or allergic reactions, etc. It is unlikely the vaccine will stop the spread of the virus, so there has to be an element of caution until the virus is no longer a global problem.
What level do you think that we should start saying, our supply is bigger than demand here? We need to start taking our supply and sharing it with the world.
We're going to do it. By the end of June, beginning of July, we're going to be giving out 80 million doses for a starter.
Yeah.
Just for a starter, and there's more coming after that.
That's good to hear, and I hope a lot of the single-dose vaccines are sent to the countries in crisis.
As far as our handling of the pandemic, as a nation, as a scientific community, if you could change one thing or make an improvement on one thing on our response so far, what would it be?
Well, to me, as I've said often, it's that there's been an extraordinary amount of divisiveness in this country. That's the worst possible thing. I mean, there's differences of opinion, but the intensity of the divisiveness has, in so many respects, and one can't deny it, the politicization of a public health approach.
That is true for all aspects of life at the moment, and not just for COVID, and I honestly don't know what the answer is anymore. Social media is playing a massive part in people not being able to have an opinion without being attacked. It just baffles me today where conversation and dialogue between people with differing opinions is a thing of the past.
I mean, when someone does or does not want to do things like wear a mask, congregate setting, for reasons that are not, they don't make public health sense. They're more ideologic than they are public health. So if we were going to do something different, we could say there's differences of opinion, there's differences of ideology, fine. But when you're facing a public health challenge of this magnitude, why don't we put that aside for a minute, take care of the pandemic, then you could go back to ideological differences.
Amen.
We're talking about masking right now with the pandemic and the public health setting. I've heard you say in an interview before that masking can potentially continue past the pandemic. What role do you see?
That was taken completely out of context by people who like to gotcha.
Yeah.
No, what I was saying, thank you, let me clarify this.
I love it.
I was asked, people were saying, it's interesting, in Australia, during their flu season, they had almost no flu. They called us up and said, wow, we think that's due to the fact that we were wearing masks, we were avoiding congregate settings in order to prevent the spread of COVID-19.
That is an interesting point. Seasonal flu and influenza cases worldwide have been down a fair bit since the pandemic hit.
And we had a secondary effect that we almost had no flu or other respiratory illnesses. RSV, para-influenza, we had almost nothing. Then our winter came, and we noticed the same thing, that wearing masks, avoiding congregate settings, et cetera, et cetera. So I was asked in an interview that, do you think that some people might elect that they might want to wear a mask during the winter season to avoid flu or other respiratory illnesses? And I said, you know, it seems reasonable if some people feel that they want that extra protection, they could do it.
It's so funny how people put such a spin on things to make people look bad.
It's not going to be mandated.
My question is more so not for that gotcha purpose, but in terms of protecting yourself using a mask. You know, in March of 2020, April 2020, even on my own YouTube channel as a family medicine doctor, I was urging people to not rush to buy masks at that time, because the information we had at the time wasn't focused on asymptomatic or pre-symptomatic spread. There were shortages of PPE. Like I was seeing patients in March with no masks, not because of inadequate PPE, but because we didn't think that was mandatory.
I think this is a valuable lesson to be learned when all of this is over. We learn the lessons and then we know the facts, and then we come up with effective guidelines so that when the next pandemic hits, we are much better prepared and that people aren't just making knee-jerk reactions.
So
yes, and that's what I was saying then. And then when we found out three things, I mean, thank you for bringing that up, because that's when I get accused by people who want to do the gotcha that are flip-flopping. There's no flip-flop. Back then, there were three things. A, we were told that there was a shortage of PPE and masks, and we felt, you know, we don't want to take it away from others. Secondly, there were no data, meta-analysis at the time, that masks were effective outside of the hospital setting. And then three, importantly, we didn't fully realize how pervasive asymptomatic spread was.
That may all be very true, but we should have much better contingencies in place. Many academics and scientists have been predicting these events for many years, and they were paid little attention.
So what changed? A, it was clear there was no shortage of masks. Cloth masks work. Meta-analysis showed that, in fact, even outside of the hospital settings, masks work. And third, we were hit with the realization that anywhere from 50 to 60% of transmissions occur from asymptomatic people. That's the reason why we went from saying you don't really need to wear a mask to you should really wear a mask.
I agree here, but even in the absence of scientific evidence on masks, they could have just said to people, just wear the mask until we have gathered the facts. Worst case scenario, it has no bearing on the transmission. Best case scenario, it can help reduce transmission rates.
That's not flip-flopping. That's taking evolution of data and then making your recommendations based on the data.
yeah, in fact, if we didn't make that adjustment, that would be worse for us, because then we're not looking at the data and evolving with the science.
Well, anyone who's involved in science, to say you should never change your mind doesn't understand what science is.
Agreed.
You've become a champion of science on social media. You've become a meme. Your face has been put on t-shirts, socks, cupcakes. I've seen everybody celebrate the work that you've done, leading the way with humility, with honesty, treating science as it deserves to be treated. How does that feel?
Well, I focus on what I'm doing and not bask in that, because that's balanced by the other side of people who attack, who are not science-related, who are anti-science.
I applaud anyone's service to science like Dr. Fauci. To do it with humility and with a smile on his face is very admirable. I may not always agree with some of the things that he says, but credit where credit is due. The guy is incredible, and to do all of this with such energy and vigor at 80 years old is absolutely incredible.
It comes from everything from, you know, verbal attacks to ad hominem nonsense to threats to my life and my family.
It's disgusting, and the funniest thing about people attacking Dr. Fauci is that most of the people attacking him wouldn't understand science if it slapped them in the face.
So it's balanced.
How does that negativity affect you? That's got to be hard. I mean, as scientific communicators, I mean, if you look over the course of history, scientific communicators weren't really celebrated. Researchers were almost frowned upon when they would spend a lot of time in media.
Yeah.
How do you balance that?
No, I mean, right now you have to communicate because there's an absolute need on the public to know and understand the truth. This is something that's threatening their lives, their family, the economy. When you politicize that, when you take it out of the realm of public health and make it become almost a political statement, that's very damaging to the overall effort.
Agreed, but again, as I said earlier, I don't know how you undo these problems with society. We have unlocked Pandora's box with social media, and I generally don't know how we reunite people and take divisions away. You would think a global pandemic would do this, and at the beginning it appeared this was happening, but the longer things go on, the more rifts are being created.
And the other thing is that if you want to really get into and understand the evolving science, you've got to realize that things change, and you've got to be humble enough and flexible enough that when you get new data, that you then change what you're doing based on the data.
I absolutely agree with this too, but I think scientists and doctors need to be less rigid where science is concerned. For many years, Lyme disease and fibromyalgia, for example, were dismissed by doctors. As a result, many people suffered for years of poor health and neglect by healthcare systems. You can't treat people based purely on rigid science, because when you do that, you neglect the most important person in all of this, which is the patient.
If you say, I really want to never change, because if you change, you're flip-flopping, then you're back here, and you don't take advantage of the new data that every week, every month comes by. That's the thing that some people don't seem to understand.
Again, agreed, but you can also apply common sense in these situations before you have the data.
Well, it's like the idea that scientists can be wrong, and that's part of being a scientist, testing a hypothesis. Yeah. But science itself is a process that can never be wrong.
Well,
right?
as we've learned in medical school, when you do these kinds of things, that the mentors always told us that science, by definition, is self-correcting.
Another amen there.
You said that beautifully. I want to read to you a statement that one of my colleagues shared with me late last night when I mentioned to them that I was going to be interviewing you. She's a cardiologist on the West Coast, and I want just to read this to you to highlight the impact that you've had on individuals that perhaps you may not come across in your everyday life. I got redeployed to a COVID unit for my last 3 months of my cardiology fellowship. I went to work every day before we had adequate PPE, and I was putting people my age on ECMO daily. I was constantly worried I was going to die. I was so scared. But I would come home from work and see Dr. Fauci on television, and he honestly made me less scared.
I think that the media has to take so much responsibility in creating this level of fear in people.
Hearing that, how do you feel?
Well, that obviously makes you feel good. I mean, because that's what I do. That's what my job is. I'm a physician, I'm a scientist, trying to get as accurate information out to people. So if I can make a cardiology fellow feel good, that makes me feel good.
Bless him, he is properly choked up.
You've been doing this for a while. You've served under many presidents. You've worked with administrations of left, right, in between. Is this the highlight?
We're still in the middle of it.
Okay.
I'll tell you that when it's over. We're still in the middle of it. We still have a way to go. It looks like we're going to nail it. I think we are. Science will come to the rescue. But yeah, I believe we're going to get out of this. This is going to end, and it's going to end, and hopefully we'll learn a good lesson and be better off for it.
It will absolutely be over, and it is absolutely science to the rescue.
For sure. So everyone at home, get vaccinated. That's the goal. We need to get everyone vaccinated so that we don't have to play the game of who's vaccinated and who's not.
Okay, so that is a nice segue into whether I will vaccinate and what my thoughts are on the vaccines. So I will say 3 things here. Number 1, I won't be vaccinating. That's not because I have any concerns about the vaccines, but it's because I have a track record of adverse reactions to medications due to genetic mutations in my body. The second thing that I want to say is that I think it's sensible for people to have the vaccine, but if somebody chooses not to have it, then it's their choice and they certainly shouldn't be lambasted. We need to include as many people in the conversation as possible. And number 3, if you have underlying health problems, then please go and get the vaccine. Please do not get it because Dave from London says it's a bad thing because he read it on Facebook. If you enjoyed this video, then please watch this one because I think you'll enjoy it equally. And as always, remember to look after your body because it's the only place you have to live. And I'll see you next time.